Hello, thank you for having me. So something completely different. So now in Belgium we have a law since 2002, and so in healthcare, nurses have an important role. I have lots of access and discussions with the patient. And so to give you a quick overview, who am I? I'm a psychiatric nurse with an academical background. So I studied nursing, psychiatric nursing as a bachelor, started working in the hospital in a psychiatric ward. And then there were kids, and then I thought about some studying, then a master's degree. I went to university college because it was easier, no weekends, no late shifts, lots of holidays. And all of a sudden I came into contact with Johan Bilzen. Some of you will know him. He's one of the authors of the famous Hasselt research in Belgium, which was the beginning of the euthanasia discussion in Belgium. And since a few months, I can call myself a doctor. So this research was focused specifically on nursing students because I'm a nursing lecturer. And so during my PhD research, or in my PhD research, we asked all Flemish final year nursing students, so they're just before graduating, how well do you feel prepared about dealing with euthanasia? And shockingly, because again, we have a law since 2002, so more than 20 years, they lack preparation. They did not know how to deal with euthanasia requests. And so we thought, let's do something about it, and we developed a simulation module. The module clearly is like, if a patient asks you a euthanasia request, or pose a euthanasia request, sit down, listen to the patient, instead of screaming out, running out of the room. So the purpose is not, is it a legal request, can we go through it? It's just like sit down, listen to the patient, and listen what is going on. So this module is a build-up of 4 parts. A 4th part is a small 10-minute PowerPoint, which it's an online module, and it's just like a quick overview again of what are some communication skills to keep in mind, and a quick overview of the law. Then we made a good practice video where there is a patient with a psychiatric illness, and we have a healthcare worker. It can be a nurse. It's not defined as a nurse. It can be a social worker or whatever. And they have a conversation, and at the end of the conversation, so it's just a regular follow-up meeting after hospitalization, and at the end she posts like, perhaps in the future euthanasia might be a solution for me. And then we have the real simulation, and of course afterwards the most important part, the debriefing. So I mentioned this a bit before, so the online module, some preparation, the good practice video, and it's specifically called a good practice video, not a best practice video. It's just an example of how can you handle this discussion and what can you do when the question is posed. So we had 3 different simulation scenarios in the module. One is about a person of about 20 years who has cancer, phase 4 cancer, kidney cancer, and he has to go into dialysis, and that's a no-go for him. Then we have a second one, is an elderly and with a polypathology, so she has lots of things. And the third one is one about a person with a mental illness. In each scenario, so there are 2 students. One student will be the patient, one student will be the nurse. In each scenario, they will have a short debriefing before, so they know their scenario, and then they start playing. The other students are in another room, so you have the simulation room, and that's broadcast to another room. And so in the other room are the other students, and they have some specific tasks. Some of them have to mention specifically on the communication, some on body language. And afterwards we have a debriefing, and it's a reflective method, which is another kind of debriefing, as in the more typical one, where you do like ER things. And so what did I find of the module? So this module was tested in 3 different university colleges. University college where students are very experienced in simulation and where students were not experienced in simulation. And so afterwards they found it, it's a very valuable module just for the background and just to have to not be overwhelmed to the question. So they really appreciate it. They have some handles, some tips, just like how to deal with the request and not to be afraid anymore if they get a request. And I found it a very valuable addition to their education and specifically for their later nursing careers, where they will be confronted with euthanasia. And so they really also like that the topic was presented without any taboos. So it was just a regular case, a patient case that could happen in real time or in real life during their career. And just to give you an idea, one of the questions with the Flemish final year nursing students, about 60% of them was ever confronted with euthanasia during their internships. That's something I've mentioned before. But also, so we develop it now for our students where there is a law in Belgium on euthanasia. I have traveled all over Europe to give lectures about how is end-of-life care in Belgium, how it is organized, what it means for nurses and nursing students. And I have done this simulation module in other countries where there is no law. But also, this module is something other students, like I remember very well the Greek students. The Greek students, they said, we also get these questions. People are asking for their end of life or active life ending, and we do not know how to deal with this. So it's not because there is a law in your country, this is a valuable simulation module, it's also a valuable simulation module if there is no law. And if this works well, this QR code should get you directly to the open access article published about this simulation module. Thank you.